Welcome to the Weiser Center for Prostate Cancer, a sanctuary for hope where you and your family can thrive, from diagnosis through treatment, with patient-centered care from our team of experts and the wisdom of advocates and former patients.
Following a prostatectomy, patients will need to undergo bladder retraining through pelvic floor therapy with a physical therapist who is trained in this specific area. We also have a process called penile rehabilitation.
When you do have surgery, you will have a Foley catheter in place for 7 to 10 days. Maybe sometimes a little longer depending upon the surgery itself. When you come to see nursing, that's when we're going to start talking to you about rehabilitation. And at that point, we'll go into a lot of detail about not only what we call penile rehabilitation, but we'll also talk about the rehabilitation for incontinence. When you're having the penile rehabilitation, it's on you. You don't have to do it, but we strongly encourage it for your long-term benefit. And that includes keeping the length of your penis, keeping the blood supply, preventing the scar tissue, and preventing Peyronie's disease. With penile rehabilitation, we not only use the medication, but we also utilize devices to, again, increase the length of the penis, increase blood supply, and break up the scar tissue. We find that sometimes the sexual tools that we give you in the beginning are very mechanical. And as time goes on, some men are able to get erections on their own. That is a percentage that we never know what it's going to be. Each man is individual. And it can be 6 months to 2 years before you know what your maximum erections are going to be at that point. With that, we have other tools, other options. If the medications don't work and the medications with the devices don't work, we often will go to injections. We would bring you into the clinic. We strongly recommend the partner come as well. And we would teach you how to use the medication and what the side effects can be of those medications.
First, let me mention that sex therapists are certified by the American Association of Sexuality Educators, Counselors, and Therapists to provide expert care to people who experience sexual difficulties. And sex therapists in the prostate cancer also have expertise in doing that in the prostate cancer environment.
As a sex therapist for the prostate program, I meet with patients and their partners to talk about their sexual needs and how this is impacting them emotionally. It's similar to traditional therapy. It's talk therapy. We talk about goals. We talk about the impact that everything has taken on the person. We talk about loss. We talk about, what the sexual needs are at this point. Every individual is at a different point in their life. For some people, finding a deep connection sexually is really important. Other people are in relationships or are single where that isn't as much of an emphasis. My goal is to meet you where you are and to be able to give you a space to talk about what those needs are.
And all along that process, we're here to be your support. We encourage you to communicate with us and let us know what you need and what is working and what is not working. That's what we're here for, that's what the team is here for, and we encourage that communication with us.